What if the very health checkups you've trusted for years were quietly putting your life at risk? Every year, millions of people over 70 walk into clinics for routine tests, thinking they're protecting themselves. But the shocking truth is this: up to 37% of those medical tests lead to unnecessary treatments, dangerous side effects, or lifelong complications. And here's what almost no one knows: 99% of seniors over 70 are being over-tested without realizing it. Even worse, one of the tests on this list, number 1, causes as many cancer cases in the United States as daily alcohol consumption. That means a single scan could be as risky as pouring yourself a drink every day. This is not the story your doctor tells you. It is not on the posters at your clinic. But today, we're uncovering it all. In this video, you'll learn about 5 common checkups that may look harmless, but could quietly push you closer to surgery, stroke, or worse. And let me warn you now. Number 2 on this list is something almost every senior has already gone through. The truth behind it will shock you. Before we begin, I want to hear from you. Where are you watching from? How old are you? Have you ever had a medical test you regretted? Share it in the comments below. We read and reply to each one with personal advice. And if you value your health, subscribe to our channel so you never miss the truths that could save your life. Now, let's begin with the first checkup. One that seems completely harmless but can quietly damage your quality of life. As we grow older, the pressure to keep up with medical checkups becomes stronger than ever. Doctors, clinics, even advertisements constantly remind seniors that early detection saves lives. And yes, some tests are absolutely life-saving. But here's the hidden side no one talks about. Not every checkup is good for you. Especially once you cross 70. In fact, the wrong test at the wrong age can trigger a chain reaction you never asked for. From unnecessary medications that damage your body, to invasive surgeries that steal months of your life, to scans that expose you to radiation strong enough to spark cancer. That is why today's video matters. You are going to discover the 5 health checkups most likely to harm you after 70. Backed by real scientific studies and patient stories you'll never forget. And more importantly, you'll learn the safer, smarter alternatives that can truly protect your health, extend your independence, and keep you out of the hospital. So if you care about staying strong, active, and free from medical traps, stay with us until the end, because the final checkup on this list is not only the most common, it is also the most dangerous. Number 5. Bone density scan, DEXA scan. It sounds harmless, a quick scan, no needles, no pain, but after 70, almost everyone shows lower bone density. And that single number on a screen often pushes seniors into powerful medications like bisphosphonates. These drugs can cause jawbone decay, severe reflux, and brittle bones that break in strange ways. Take Rose, a 76-year-old retired piano teacher. She had no falls, no fractures, yet after one scan she was prescribed strong medication. Within months, her jaw hurt so badly she couldn't play piano. Once she stopped the drugs and switched to natural strategies, vitamin D, calcium-rich foods, and resistance training, she regained her health and joy. Studies prove it. Lifestyle changes reduce fracture risk by more than 20%. While medication at this age makes almost no difference. So ask yourself, have you ever taken a test that scared you into treatment you didn't need? Stay tuned, because the next test can lead to something even scarier: unnecessary brain surgery. Number 4. Brain MRI for memory loss. Forgetfulness at 70 sparks one big fear: dementia. Doctors often respond by ordering a brain MRI. But in most seniors, these scans only show normal age-related changes, tiny white spots or mild shrinkage. Yet once doctors see them, it can set off a storm of panic. More tests, even dangerous procedures. George, 74, felt a little forgetful. His MRI showed changes that terrified him. He stopped driving, isolated himself, and spiraled into anxiety. Months later, a simple paper-based memory test showed he was completely normal for his age. What he needed was better sleep, hydration, and brain exercises, not a scan. The truth: unless you have seizures, sudden behavior changes, or rapid decline, an MRI rarely helps. A simple cognitive screening is safer, faster, and avoids the fear trap. Have you or someone you love ever panicked after a scary test result? And if that shocked you, wait until you hear about the heart test that can push healthy seniors into unnecessary surgery. Number 3. Cardiac stress test. Doctors often order this test when seniors feel a little tired or short of breath. The problem? In people over 70, stress tests produce false alarms almost 40% of the time. That false alarm can lead straight to angiograms, stents, or bypass surgery that you never needed. Raymond, 75, was active and walked every day. A stress test flagged a possible problem. He ended up with a stent, kidney damage from contrast dye, and a 6-day hospital stay. And his fatigue? It was simply dehydration and low energy from meals. The science is clear. For seniors without clear chest pain or major symptoms, stress tests do not improve survival or quality of life. A safer option is a resting EKG or a low-radiation coronary calcium scan. So here's a question. Would you want to risk heart surgery just because of one unreliable treadmill test? But as dangerous as that sounds, the next checkup is one you probably thought was essential, and it comes with a shocking 10-to-1 risk-to-benefit ratio. Number 2. Colonoscopy. For decades, colonoscopy has been the gold standard. But after 70, and especially after 75, the risks skyrocket. The harsh laxative prep can cause dehydration. The sedation raises risks of memory problems. And the procedure itself can cause tears, bleeding, or even heart rhythm problems. In a massive study of over 1.3 million Medicare patients, only 2 lives were saved per 1,000 colonoscopies after 75. Yet more than 20 patients suffered serious complications. That means the risks outweigh the benefits by 10-to-1. Dana, 73, had no symptoms and no family history of colon cancer. Yet she was pressured into another colonoscopy. A tiny polyp was removed, her bowel perforated, and she spent 9 days in the hospital. All for something that never needed treatment. Experts now recommend stopping routine colonoscopies at 75. Safer alternatives like the at-home FIT test can still catch most dangerous cases without the pain. Prep, or risk. So I ask you, if you've already had clean results, would you put yourself through this again? And now, we arrive at number 1, the most common, most overused, and most dangerous test for seniors. This one alone is responsible for up to 5% of all cancers in the United States. Number 1. Annual full-body CT scan. Marketed as the ultimate preventive tool, full-body CT scans are sold in private clinics as peace of mind. But here's the nightmare truth. A single scan delivers the same radiation as 500 chest X-rays. According to recent studies, up to 5% of all cancers in America may now be caused by CT scans. That's the same cancer risk as daily alcohol consumption. Marcus, an active 80-year-old, took part in a senior elite checkup that included a full body scan. The scan showed a tiny harmless nodule. That led to more scans, a biopsy, and a collapsed lung. 2 months of recovery, all for something that never needed treatment. The American College of Radiology is clear. There is no proven benefit in using full-body CT scans for healthy seniors without symptoms. Instead of chasing shadows, focus on what really matters: regular checkups with your doctor, targeted tests when symptoms appear, and a lifestyle that keeps you strong. So before you ever agree to a full body scan, ask yourself, is the peace of mind worth the risk of cancer? By now, you can see the pattern. The very tests designed to protect you can become traps. And once you step into that system, it is hard to get out. One scan leads to another. One unclear result leads to invasive procedures. And suddenly, you're no longer living your golden years. You're stuck in a cycle of fear, medication, and hospital beds. The statistics are chilling. Studies show that nearly 37% of medical tests in seniors result in unnecessary follow-up procedures. 1 out of every 20 cancers in the United States may be caused not by smoking, not by drinking, but by medical imaging itself. And for colonoscopies past 75, the risks outweigh the benefits by a ratio of 10-to-1. But numbers are only half the story. Think of the faces behind them. Rose, who lost her music because of a pill she never needed. George, who lost his freedom because of a scan that meant nothing. Dana, who nearly lost her life after a routine, procedure. These are not rare tragedies. They are everyday realities for seniors who trusted the system without asking the right questions. The danger is real, but here's the good news. You are not powerless. Lifestyle changes like strength training, balanced nutrition, deep sleep, and targeted screening when symptoms appear have been proven to prevent fractures. Protect your heart and extend your life. Prevention is not about piling up tests. It is about choosing wisely, protecting your independence, and living with strength and clarity. So before you say yes to the next test, pause and ask, what happens next if this comes back abnormal? Will this test truly protect me? Or will it open a door I don't want to walk through? Now it's your turn. Have you, or someone you love, ever gone through a medical test that turned out to be unnecessary? Even harmful? What happened afterward? Share your story in the comments below. Your experience could save another senior from making the same mistake. We read every single comment, and we reply with tips and advice tailored to your situation. This community is built on sharing real stories, real science, and real solutions. And if you found today's video eye-opening, don't keep it to yourself. Hit the like button, subscribe to our channel, and turn on notifications so you never miss the health truths that could protect your life. Remember, staying safe is not just about avoiding danger, it's about making smarter choices. And together, we can spread that knowledge to millions of seniors around the world. So, there you have it, 5 health checkups that may look protective on the surface, but after 70, can do more harm than good. The truth is simple. Modern medicine is powerful, but it is not perfect. Sometimes, less is more. Your health and your time are too precious to waste on unnecessary fear. Real prevention is not about endless testing. It is about living with intention, staying active, eating nourishing foods, building strength, resting deeply, and using medical tests wisely. Before you leave, I want you to carry one question with you. If a doctor recommends a test, ask them, what happens next if the result is abnormal? If the answer is vague or the risks outweigh the benefits, it may be time to pause. That single question can protect your independence and your future. In our next video, we'll uncover the everyday morning habits that silently raise your risk of heart attack after 60, and how to replace them with routines that protect your heart and energy. You will not want to miss it. If you found this video valuable, share it with a friend, a parent, or a loved one. Together, we can protect each other from unnecessary risks and make the senior years truly the best years of life. Thank you for watching, and I'll see you in the next video.